Hello, everyone. So my name is Zoe. I am a clinical sustainability fellow and also a midwife. I am working at Great Western this year, and we have been working on trying to reduce the carbon footprint of infant feeding. In Great Western, we decided to focus on infant feeding because we know it's a carbon hotspot of maternity, and that the carbon footprint of breastfeeding is similar to formula, but there is evidence that breastfed babies have fewer long-term health issues. So it would improve the carbon footprint of health over time. Breastfeeding is also associated with less waste. We support around 4,200 births a year. We know that around 75 to 84% of birthing people commence breastfeeding, but by the time they're discharged from the postnatal ward, around 8% have stopped, and a further 20% stop in the first 2 weeks at home. We also noted that we had significant volume of complaints regarding feeding support in the hospital, with birthing people feeling that they're not getting the support they needed. Feeding issues are also related to readmissions for feeding support, weight loss and jaundice, which obviously has a high carbon footprint of people returning to have those appointments. And obviously having feeding issues can affect families' mental health as well. So it's something that we wanted to look at. We are a BFI accredited hospital, recently had an audit which found some areas that needed improvement. So therefore we joined with the infant feeding team to help find solutions to some of these problems. We met as a team, including the postnatal ward manager and also our representative from the NMVP, so giving that the patient voice, and the infant feeding team. We decided that we wanted to implement a feeding support group because we have feeding support in the community, which we know is really well received families, and we wanted to create that kind of peer-to-peer kind of relaxed support in the Woodland Suite, which is currently a half patient space, half staff rooms on the postnatal ward. We also wanted to encourage antenatal women to attend because we have a high induction rate and also induction failure rate of women not being able to get into labour, and we know that hand expressing can support with that. So whilst we discovered that it would be very difficult for us to judge that and to look into the data for that for this project, it's something that we're thinking about looking into ongoing. The support group we decided would be day and would be run by our healthcare support team and midwives when available, and also our volunteering team as well. And then 3 times a week, the infant feeding team would come along for an extra hour following to give extra specialist support, tongue-tie assessments, and just be available for families. We also wanted to change from it being a half staff room, half patient space, because we know that's not very great for staff's kind of relaxation and well-being. So we looked at how we could redesign the ward and utilise rooms that are currently underutilised at the moment. So the plan is to move the staff room to another space. The Woodland Suite would be solely for patients and families to use. Another part of the project that we wanted to look at was reducing the wastage with formula feeding, because currently we use single-use bottles. Lots of the milk is wasted in there if babies don't drink. And obviously that has got a high carbon footprint. So we have looked to get a part of the Woodland Suite changed into a new milk kitchen for families. But again, that's going to take some time. So we worked with estates, but that is kind of ongoing. So we haven't been able to look at that specifically for this project. We started by surveying the volunteers, healthcare workers, and also midwives, looking at their confidence to support with a group to see if there would be any additional training needs, to see if people felt that, or staff felt that they had enough time to support with feeding, and if they think families get enough support. The results were slightly unsurprising, I suppose, that midwives often felt that they didn't have enough time to support families with feeding. We also discovered that some of our support workers would require some extra training and support before going ahead and facilitating the group by themselves. We also looked at the kind of patient feedback which we had come through from a NMVP survey which had gone out a few months before, and found that families felt that they needed more support. So first of all, we set up a rota. We supported the staff that needed extra support by somebody who was confident to facilitate the group, coming along and supporting them with that. We have a tannoy system, so women were, or families were told about the group. To start with, we were not getting very many families come along, so we changed things as we went, and we would go and announce into the bays that we were about to start the support group, and also try to encourage staff to encourage families to come to get that extra support. Since we have implemented the group back in November, we haven't had any further complaints about feeding, which has been great, and we've received some really positive feedback from families. It's been difficult to judge whether the group has had any effect on our breastfeeding rate at the moment, but we feel that it's really well received by not only the staff feeling like families can get that extra support if they need it, but also obviously from the families themselves. And the next steps.
Sorry to interrupt. Sorry? Just about 30 seconds left.
Oh, okay, no trouble. Sorry. The next step, we are considering, or we'd like to start a support group overnight as well, so that more families have got access to the support, and to continue to monitoring the feeding rates and readmission and outpatient appointments as well.
Thanks so much. Sorry I interrupted.
Thank you. No. Thank you so much. Yeah, that was great. I couldn't see the clock, so that was really handy. Thank you. Rachel.
Any questions from the judging panel?
I'll come in here. Thanks, Zoe. That was really interesting, and it's such an important area because we know, particularly in postnatal and infant feeding, it is an area where often there's a lot of dissatisfaction in terms of support. My question is about, I suppose, the environmental benefits from it, and I appreciate this is quite a short time frame to do this. So if you haven't done already and moving forward, what data would you collect to be able to measure the environmental impact of doing support like this?
Yeah, absolutely. And sorry, I realized I didn't actually put much of that in the presentation at all, or have time to talk about it. Yep. So what we are hoping is that, and what we managed to calculate with Rachel and Inge's support, is that by increasing breastfeeding rates by 5%, if we're able to do that with the extra support, it would reduce the carbon footprint. I think it was by about 1,000 kilograms from what I can remember a year. We are also hoping that by offering that extra support, if we that we would reduce the amount of outpatient appointments and extra midwife visits at home for weighing babies, so that would reduce the scope 3 emissions. And also we calculated reduced bed days from babies being readmitted for feeding support, weight loss and jaundice as well. And then the next part of our project will be reducing the amount of wastage from formula milk. Thank you.
I'll just put the carbon figures in the chat.
Sorry, thank you, Rachel. I didn't have that to hand.
Any other questions from the judging panel?
Yeah, I'll come in quickly. Just for the purposes of the event today, I just wondered if you could touch a little bit more on like the clinical outcomes side of things, perhaps.
Yeah, of course. So we're hoping that we know from just speaking to staff that it has relieved their pressures and feeling that they have got, for example, if they know a woman is having, or families are having really a difficult time with feeding, that they will have the extra support from the group, but also from the infant feeding team, who are now much more involved with the ward and offering that kind of hands-on support, which previously they hadn't been, kind of with their other pressures, hadn't been so present on the ward. So that's a benefit for the families and also for the staff as well. And yeah, we found that midwives just, sorry, I'm not explaining this very well. Midwives feel that they have got another place, another kind of tool in their kit for helping with feeding support.